Welcome to the Smiles Are Wild channel, brought to you by Pediatric Dental Associates and Orthodontics. My name is Amy Morgan. We will be bringing you fun and educational videos weekly to help you take better care of your child's oral health care needs at home and on the go. Make sure to subscribe and turn on notifications to see all of our new videos. And remember, it doesn't really matter how you take care of your teeth as long as you take care of them from the beginning. Let's get started on today's content. So again, February is National Children's Dental Health Month, and we're going to kind of go over some history about how that got started, and then I'm going to give you 5 quick facts about children and cavities that may or may not be a huge surprise to you as far as numbers go. I was pretty shocked, even working in pediatric dental for all these years. Just kind of reading these numbers out loud is kind of shocking. So we want to kind of get things kicked off for this month. With some of this information, and then we'll be sharing content all month that's related to children's dental health. We try to do that anyway, but it's going to be a lot more honed in on specific facts and numbers and things like that to kind of get you thinking about how important it is and make sure that you're spreading the word that while you may be bringing your child to the dentist, you know, there are parents out there who may not know that they should be bringing them to the dentist right now, or they have some qualms about doing that, and just kind of letting them know that it's okay to go ahead and get that process started. So again, National Children's Dental Health Month actually did not start out as a whole month. It actually started out as one day, and that was created in Ohio, and that was in February of 1941. Since then, the concept has grown from a 2-city event there in Ohio to a nationwide program. The American Dental Association actually held its first national observance of Children's Dental Health Day on February 8, 1949. So within 8 years, it became a national event. And the single day observance became a week-long event in 1955. And in 1981, the program was extended to a month-long celebration, now known today as National Children's Dental Health Month. So I think that's really cool that a program that just started as a small citywide event there in Ohio has now become a national push to get this information out there to parents and children to let them know, you know, that we need to be taking care of our teeth and how important that is to our overall health. So that's pretty cool that just in, you know, this amount of time that it's grown so much. You know, it's been proven that attitude, this says here, attitudes and habits established at an early age are critical in maintaining good oral health throughout their lifetime. And that is one of the things that we strive to do here at PDA&O, is to make sure that we are giving you the tools that are needed for you to teach your children so that they will start learning at a young age, so that that carries on with them throughout their adult life when they're not in your home anymore. We do realize as parents that can kind of be a struggle sometimes, and we're here to help. If you ever have questions, feel free to go into our messages on Facebook or Instagram and kind of let us know if you're having any questions. You can also always feel free to email me directly. My email is amy@smilesarewild.com, and I'm always happy to answer those kinds of questions if you're having trouble. You can also refer back to any of our videos. Our videos can be found in the Facebook video section on our page, and you can also find them on YouTube. So feel free to, you know, peruse around there, try to find some. I know we've even had some, we had one last summer where my sons actually went and just tried out a bunch of different toothbrushes. So maybe just even your kids seeing that, see how they work, things like that would be a fun thing for them. And we're going to be incorporating some new videos, hopefully weekly here on out, so that we can get you some more information out there. And again, if you have a topic for sure that you want us to cover, please let us know. We'd be happy to try to accommodate those for you. So, you know, in honor of National Children's Dental Health Month, we just want to share some really important facts that we feel like parents should know. So cavities are surprisingly common in children. So when parents come in, a lot of them are kind of mortified that their kid has had to have a cavity filled or crowned or something like that, but they're actually very common, and they're actually 5 times more common than asthma. They're 7 times more common than hay fever, and also more common than type 2 diabetes and obesity. So cavities, you know, I've heard it said, I don't know exactly where the term came from, but that cavities is the leading, you know, disease in children. So a lot more children have cavities than they do anything else. So if your kid ends up getting a cavity, just know they're not the only ones, and that we have dealt with it before. The next one I have is just that many of those cavities end up going untreated. A study by the CDC, which is the Center for Disease Control, I believe, reports that approximately 42% of children ages 2 to 11 have untreated cavities. So that's almost half of the kids in the U.S. have cavities that they are not getting treated by a dentist. So that's something that we want to try to eliminate here in our area, is just to make sure that as cavities present themselves, that we're getting those taken care of in a quick manner. The next thing we want to kind of review is not only can cavities affect the children's oral health, overall health, and self-esteem, but they can also affect their academic performance. The Center for Health and Healthcare in Schools reports that 51 million school hours are lost each year due to dental-related issues. So, and that, from what I understand from that study, is that it's actually children in pain. So something's bothered them. It could be something as simple as something got stuck between their teeth. They didn't know what to do, all the way to severe pain that's causing up to a root canal in a permanent tooth. So that runs the gamut of all those things that were dental related. It could also be related to a fall or an accident or something like that. So that does run that, but that's 51 million school hours a year. So that's a lot. So that's across the U.S. And then over 80% of the cavities that children get are on their chewing surface of their teeth. Dental sealants help to protect against these cavities, but only 18.5% of children have at least one sealed permanent tooth. So we want to make sure that when we're coming in, we always do an exam. We're checking for those sealants. You're usually going to get them at age 6 and age 12, just kind of depending on how your child's teeth are erupting. But that's the general guideline for that they're going to be getting those when they get their 6-year molars and their 12-year molars. Sealants are normally designed only to go onto permanent teeth. And that is just because the grooves in permanent teeth are going to be deeper, and it's going to be harder to access that, to get the bacteria out of there, food stuck out of there, things like that. So we go ahead and seal those down. And fun fact that is not on this paper is that I actually went to go see my general dentist last week, and they were super impressed with my sealants that I've had. And I literally got my sealants when I was like 17, years old or younger. So I got them as a child, and they're still in. I have not had them resealed as an adult at all, and they are still there. So they can last a lifetime if you take care of them. And the last thing that we just want to discuss, and this is something that we talk about from the standpoint of our office and what we believe here, we follow AAPD guidelines, which the AAPD is the American Academy of Pediatric Dentistry. And so this just says fluoride has proven to be the most effective way to prevent cavities. Unfortunately, more than 100 million Americans do not get enough fluoride from their tap water. So a big push for the National Children's Dental Health Month this month is to drink tap water. I know a lot of parents prefer to filter it and things like that, and that's fine if that's what's working for your family. But just know that sometimes, the tap water is best for sometimes. Sometimes you drink in the bottled water and it's not fluoridated. So they're not getting the right amount of just fluoride that would be that has been put in our city water that is there for their, protection for their teeth. So I know there's a lot of back and forth on, what that means, and people have their own opinions about that. But as the office as a whole, we follow AAPD guidelines, which means that we do recommend fluoride, especially fluoridated water and fluoridated toothpaste for all children. And that's kind of regardless of age. There's a certain age where they have to take just a smaller amount of toothpaste versus a bigger amount, just to try to prevent some swallowing. But other than that, across the board, we want to make sure that they're using fluoridated toothpaste for sure. And I just think the bottled water thing is something really important to point out, because a lot of parents were on the go. We're drinking bottled water all the time. It's totally fine. We're happy that you're drinking water, but just know that that water normally is not fluoridated. And so you want to try to introduce tap water as much as you can for your kids. So again, today, short, sweet, we just want to let you know that we are starting our National Children's Health Month initiative this month. You're going to be seeing lots of facts and figures and things like that going up to kind of let you know how things are happening. These are usually national numbers, so it's not necessarily right here in Northwest Arkansas. It's going to be national overview numbers that we've gotten from the AAPD or the ADA. And you'll see all that information being posted over on Facebook and on Instagram. You can find both of those social media handles by following Smiles Are Wild. And again, please remember that if you have any questions, any concerns, you can leave us a comment. You can send us a message, or you can also email me directly. My email, again, just one more time, is amy@smilesarewild.com. We hope you'll join us next week when we bring you more information from our office And we appreciate, as usual, for you listening and watching. Thanks again.
Thank you so much for watching. Make sure to subscribe and go visit us on smilesarwild.com.